Hello students, as you know, the railway pharmacist recruitment advertisement has been published. It is a golden opportunity to all the pharmacists to join in railways. Today we will discussing some previous year railway pharmacist exam questions and its explanation. First question, indicate the gas used for sterilization. Options are cyclohexane, chloroform, nitrous oxide, ethylene oxide. Answer is D. Ethylene oxide. Ethylene oxide is gas is used for sterilization. Nitrous oxide N2O is used as a carrier gas with oxygen for general anesthetic. Cyclohexane used as a solvent in manufacturing. Next question, what is the diameter of large unilamellar vesicle? Options are 0 to 100 nanometer, 400 to 600 nanometer, 100 to 400 nanometer, 600 to 800 nanometer. Answer is C. 100 to 400 nanometer. Less than 100 nanometer is as a small unilamellar vesicle. Small. Another is giant. Giant unilamellar vesicle is larger than 1 micrometer. Next question, cryoscopic method is used to adjust. Options are particle size, diffusion, viscosity, isotonicity. Answer is D. Isotonicity. For adjusting tonicity of pH, first is class 1 method. Class 1 method include cryoscopic method. Another is sodium chloride equivalent method. Class 2 method is White Vincent method, Sproul's method. Cryoscopic method is to adjust the isotonicity of a solution by calculating the amount of each substance needed for achieve desired freezing point. Next question, question number 4, indicate the use of lanolin. Options are preservative, emollient, viscosity controller, coloring agent. Answer is B. Emollient. Next question, ethylene gas promotes. Options are cell division, abscission of leaves, fruit ripening, root formation. Answer is C. Fruit ripening. Next question, question number 6, which type of resin present in benzoin? Options are oleogum resin, oleoresin, balsamic resin, gum resin. Answer is C. Balsamic resin. Oleogum resin is obtained from asafoetida, obtained from Ferula foetida. Another is myrrh, obtained from stem of Commiphora mulmul. Another is gugul, obtained from Commiphora vidi. In fat soluble vitamins are binding to. Options are beta 1 globulin, beta 2 globulin, alpha 2 globulin, alpha 1 globulin. Answer is C. Alpha 2 globulin. In fat soluble vitamins are binding to alpha 2 globulin. In case of water soluble vitamin bind to immunoglobulin of human plasma. Next question, in universal indicators a pH of 7 is shown with Options are blue color, pink color, yellow color, green color. Answer is D, green color. For pH range less than equal to 3, strong acid is color red. pH 4 to 6, weak acid, color orange or yellow. For pH 7, universal neutral, color is green. pH 8 to 10, weak alkali, color is blue. Next question, diosine on hydrolysis gives options are xylose and rhamnose, glucose and galactose, glucose and rhamnose, glucose and xylose. Answer is C, glucose and rhamnose. Diosine on hydrolysis gives glucose and rhamnose. Next question, emitin and alkaloid of ipecacuanha act as options are antimalarial, antiseptic, amoebicide, antidiarrheal. Answer is C, amoebicide. Emitin and alkaloid of ipecacuanha act as amoebicide. Nicotinic antagonist is options are suxamethonium, hyoscine, decamethonium, atropine. Answer is A, suxamethonium. Suxamethonium is a succinylcholine, is a depolarizing skeletal muscle relaxant, and for skeletal muscle relaxation during surgical procedure. And hyoscine is a anticholinergic or antispasmodic agent used for the treatment of smooth muscle spasm. Next important drug, atropine. Atropine is a muscarinic antagonist used to treat poisoning by muscarinic agents, organophosphorus poisoning and other drugs, and it will help treat many conditions like this medicine is used to reduce saliva and fluid in the respiratory tract during surgery, and it also used to treat insecticide or mushroom poisoning, and it can be used on emergency to treat slow heart rate. In case of bradycardia, slow heart rate means bradycardia. Atropine is also used in case of bradycardia. Another drug is decamethonium. Decamethonium is another name is synecurine. Is a depolarizing muscle relaxant or neuromuscular blocking agent and is used in anesthesia to induce paralysis. Next question, sterilization by autoclave is an example of for options are radiation sterilization, moist heat sterilization, dry heat sterilization, gaseous sterilization. Answer is B, moist heat sterilization. Sterilization by autoclave is an example for moist heat sterilization, and sterilization by hot air oven is an example for dry heat sterilization. Most important question. Let's see the mechanism of sterilization. First, radiation sterilization mechanism is lethal mutation. For moist heat sterilization, it is coagulation of protein. For dry heat sterilization, it is oxidation. For gaseous sterilization, it is alkylation. Most important for exam point of view. Next question, which one of the following lymphocytes produce antibodies? Options are helper T cells, macrophages, B cells, T cells. Answer is C, B cells. T cells is thymus specific antigen. B cell is immunoglobulins antibody. Next question, the end point of redox titration is, options are internal indicator only, indicator, potentiometric and amperometric methods, conductometric technique, potentiometric and indicator method. Answer is B, indicator, potentiometric and amperometric methods. The end point of redox titration is indicator, potentiometric and amperometric methods. Next question, indicate the chemical constituent of vitamin D. Options are ascorbic acid, calciferol, tocopherol, biotin. Answer is B, calciferol. Ascorbic acid is vitamin C, tocopherol is vitamin E, biotin is vitamin H or vitamin B7. Next question, which one among the following has high glycemic index? Options are brown rice, syrupy fruits, vegetables, whole grains. Answer is B, syrupy foods. These foods are restricted for diabetic patient. Next question, question number 17. Identify the salt used for polishing the capsule. Options are starch, ammonium chloride, sodium bicarbonate. Answer is C, sodium chloride. Starch is used as a diluent for the formation of tablet. Sodium bicarbonate is used as a disintegrating agent for tablets. Next question, question number 18. Reduction in chemical reaction is the, options are loss of hydrogen, gain of oxygen, gain of nitrogen, gain of hydrogen. Answer is D, gain of hydrogen. In case of reduction, gain of hydrogen, loss of oxygen or gain of electrons. In case of oxidation, loss of hydrogen or gain of oxygen or in a chemical reaction. In case of reduction, it is gain of hydrogen, loss of oxygen. In case of oxidation, loss of hydrogen and gain of oxygen. Important. Next question, identification test for protein is, options are hydrolysis test, Mollis test, Biuret test, Craig test. Answer is C, Biuret test. Mollis test is identification for carbohydrates. Craig test is for detection of acidity. Hydrolysis test used to identify bacteria that can hydrolyze starch. Next question, flame ionization detector is the most common detector for, options are liquid chromatography, gas chromatography, high pressure liquid chromatography, thin layer chromatography. Answer is gas chromatography. For liquid chromatography, high pressure liquid chromatography, HPLC, thin layer chromatography, UV detector is the most common detector for all these three. These 20 questions are from the previous year's railway pharmacist examination. Thank you.